The overall mission of the Practice Management Committee is to educate members about anything practice related as it relates to headache medicine care.
We are organized to educate as well as advocate for practices, whether it be through education to private practices, academic practices, employed clinicians. We are there to help all clinicians, whether it be your physician or advanced practice provider.
The priorities are to continue to educate members on any ongoing regulatory, practice, reimbursement related issues.
Whether it be coding, billing, finances, workflow, team management, now artificial intelligence, understanding how the regulatory and the legislative bodies of our governments are impacting our practices, and continue to advocate to ensure that practices can continue doing what they do every day. We are really about ensuring that patients have the ability to get the care that they need, because the care can be provided, as they say, no margin, no mission. So while we're here to take care of patients, we need to understand that in order to be able to do so, we have to have that financial wherewithal, that ability to make sure the practice can survive in order for any of us to take care of our patients. So I'm very, very excited to say that we have a compendium of wonderful articles, top 10s, top 5s, ways that you can really look at different topics of practice management in an easy and quick way on the AHS's website. That has been very, very useful, I think, for a lot of our members, and trying to answer some difficult questions that practice clinicians as well as administrators might have. In addition to that, we're very, very excited that the American Headache Society has laid out a position statement on how to train advanced practice providers, so we're all learning how to care for our patients with, of course, a standard of operations, so that way advanced practice providers can be more effective when they're taking care of headache patients.
So I hope the Practice Management Group will have an impact on educating all members about anything that's practice management related. So hopefully the business of headache medicine and how to care for patients in an optimal way will be better.
That they can feel more confident and comfortable in running their practices. They have the ability to ensure that their practices can keep their doors open. They have the comfort to be able to choose what type of practice model they want to have in their world. So what I think is important for members to know about is that we are here for you to help you address any challenges you might have in practice. If there's issues that come up, please let us know, so that way we can help to figure out whether or not we can help just educate you on a particular topic, or maybe we need to do some advocacy for you in certain areas, wherever you are in this country. Also know that there are resources available online for you to help figure out what's best for your practice needs.
As part of the monthly newsletter from the American Headache Society, we will continue to post top 10 tips and practice management tips on a monthly basis to help educate members on an ongoing basis on any new issues that come up. So if there's any members that have particular interest in anything practice management related, so practice management topics that they want us to address, we always welcome feedback and questions directly to us that can prompt us to try and educate the membership about practice management related issues in headache medicine. So I enjoy all things related to practice management when it comes to ambulatory operations, coding, billing, documentation, and in my role as medical director of compliance at the University of Rochester, it sort of parlays into what I do on a regular basis at the University of Rochester. So I enjoy educating members about topics that they may not necessarily know a lot about, but impact their day-to-day practice.
So as a private practice clinician, I did not want to get involved on the national scale. I did not want to get involved in this type of work, to be frank with you. The reason why I got involved, the reason why I'm passionate about this, is because I saw firsthand the impact on my practice when the government decided to make changes to regulations, and that impacted my workflow, that impacted my operations. And I felt that there was a need to be involved in this, to understand how did this happen, where can I step in? How can I change how things operate? How do I move the needle in the direction that makes sense for my practice and my patients that I take care of? Because the reality is, if we're not empowered, we truly are not at the table or on the menu, and I could not have that any longer. And I think that there's an opportunity for all of us to be able to move our practices in ways that we know is right for our patient population. But if we're not there to speak about it, to try and work on the system, we're never going to get anywhere and our patients are going to suffer.